to continue. Dr. West to Nigeria. Mr. Government to himself.
With the WH for Nigeria, and I also coordinate partners.
My name is Dr. Walter Kazadi Mulombo. I'm the new WHO representative to Nigeria. And I really want to do the first cultures I've been doing since I came, as I'm familiarizing myself with the Nigerian landscape. I want to congratulate you. I mean, it's a testimony of how you've been impacted of people of Edo State. And secondly, thank you for welcoming me, allowing me to come here. Special occasion, in addition to celebrate for the first time day from it's not a coincidence that that first time happened to be in your state. So I think what is cool, state will be looking into, you will be driving health agenda, starting the theme of this day, you know, the fair and access, universal access to healthcare. I'm out of the way COVID-19 risk state, and I'm aware of meeting with the Excellency the Deputy Governor member of the state to lead the response. It's one of the examples of how we drive the response. I also saw the way Edo State kept the second wave of as it was going on in. So I believe it's an opportunity for us to find to support they could also impact on other sectors. So, Your Excellency, we know that you have a sound agenda in health. We know that you are looking toward implementing primary health care under one roof. We know that you are looking forward to strengthening disease surveillance and response in your state. So I'm here really with my colleagues to your agenda and express our willingness to us from the response. COVID-19, as you know, has structures in our system, and about an opportunity to better for future pandemic, particularly in the way we in healthcare, so that health system can detect emergency as possible when we respond the system of our work, but at the time we need so that our response could prevent our COVID-19. So 19 brought in less good looking into the year 19, and the challenge we gave ourselves to ensure that frontline workers are all vaccinated. So I know that the program is already going on in your state. I would like to seek your support to accelerate it so that we protect at best the first line of defense. So these are the few words I had for you, but it was really first and foremost to thank you and to pay the cultural visit and to express to continue to collaborate with your state and the government of Edo State, Your Excellency. a souvenir for you to remember this day. And this is for is the same, but it's for the.
Thank you for this honor and also for the very kind words. Honor in the sense that you're celebrating today World Health Day in the field, and this field happened to be Edo State. And for us, it's an honor because we're having the the global health personality coming to Edo to deal with what for us is the most topical and urgent issue, developmental issue that we need to deal with. And I also like the phrase, that COVID-19 revealed fractures, It's only doctors that talk that way. But that's also quite poetic. Yes, for us it's even beyond fractures. I personally did not realize how broken our healthcare system is in Nigeria until the advent of COVID-19, and as far as you've been briefed, I decided to chair the response team, and the deputy governor I decided to chair the response team, and the deputy governor chairs the technical subcommittee. And that gave us direct access to the healthcare system. Even though we had started some reforms, I'll say theoretical reforms, we knew we had to fix the system. We had started with our health improvement programs. We had started thinking through restructuring the primary healthcare system, putting a new management structure in place. We started thinking about investment and financing by creating a health insurance agency and with the laws. And we started thinking about capacity, putting in systems to obtain real data for decision making. We had started all of those. I didn't know that the substructure on which we were laying these reforms was as weak as it was. So for us, with COVID and the opportunity to interact directly with the system, we then began to appreciate how much work that there is to be done. So it's beyond fracture. It's a bit more serious than that. But for us, Edo, why is this important? It's important for us from two perspectives. First, we see a huge opportunity in the healthcare space post-COVID. Particularly for Nigeria, because somehow, like in most things, we were papering over the cracks because we had enough oil revenues to seek alternative care elsewhere. Okay, now we don't have as much, but even if we did, the whole world suddenly has risen up to taking care of theirs first. So we are no longer priority. That's not that. So it's forced some rethink that at least there must be some improved care locally, even if you have to go out for another opinion. So that means a bigger market. Secondly, from our analysis, we have we stand in a very vantage position in the country. Besides our location, which is very central, which is a hub, because if you put a dot on Benin City and did a cycle, 3-hour drive cycle around Benin City, there's 100 million people. Okay? Because we're just centrally located. Which means that a thriving healthcare system will be quite profitable. I mean, healthcare will be profitable here because, as they're flying out, taking them to Dubai, and they have to travel through Benin or, where they're going to Ibadan or Lagos. So we have a very, sizable market outside, of Colombia. Then secondly, I think we have about the highest patient to doctor ratio in the country. And so for us, we just thought strategically, this is, as we're pushing for industrialization, we should also be looking at, healthcare as an investment opportunity. And so where are we today? Where we are is that we have the basic ingredients, we have the raw materials, right? But the attitudes is lacking. The capacity is lacking. The thinking, it's less of the money. It's more the attitude and the capacity. How to make people see a healthcare system in 2021 as very radically different from the healthcare system we inherited in 1960. And to say that healthcare is beyond a social good. It's also an economic good. And that you have to see it as a system. And it's not hospitals. It's not it's not ownership, right? So for me, with COVID, I then realized it doesn't really matter whether it's a UBTH or an area specialist hospital or a Fit Medical Complex or I do General Hospital. It doesn't really matter because if you are ill, you'll go to any of these facilities to get care. And then brings up the issues, okay, so what's my role as government in this system? Is my role to compete with other providers? Is my role to regulate, to make sure there's quality and standards? And that's where we need help. How do we build capacity within government to help regulate and stabilize the healthcare industry and the healthcare system? That thinking is not commonplace. And you know it all. I mean, that's the truth. So you understand the chain, you understand the linkages. So how do we get that sort of knowledge cascaded so that we can begin to help strengthen the system? Because they talk about it. Yeah, it's great, it's fine. All there's nothing that's not been done. There's nothing that's new. I think what's new is the managerial ability, particularly within government, to make these linkages and strengthen the system. And that's what we're there in need of. So I'm so excited and happy when Madam Faith, we call her Madam Faith, by the way, to see you around. I said, yes, this is the kind of we've had over the years. And said, look, how can you help? And what do we need to do? And we're in that period, right now I have a special team. Because one thing is that we're so blessed, we're lucky. We have you here, we have UBTH, we have Ira Specialist Hospital, we have a Federal Neuropsychiatric Hospital. So we can't say we lack the people who know what to do on the technical side. What we don't have is how to put it all together to create a very, very viable system. So that's, without trying to say too much, I'm a politician now. To say thank you and that we are really, really happy that you've come and we can have a first-hand conversation with you on these issues and see, is it possible? Can we get help? And if so, how? So that we can sign up today. Thank you. So we'll do one with and one without. Thank you and have a safe trip. Sometimes it's difficult to you don't find seats for them. So thank you very much.
Johnson,